Group 7 Presentation. Good day everyone. Our group is here to present our family case scenario or story. The Dimka family. We will be presenting to you the following contents. Family case story. The family genogram and eco map. The therapeutic questions that we will use for the family, including how we will present ourselves to show the right manners. The psychosocial considerations that we have identified. The list of commendations to that we believe would uplift their emotions and positivity. And finally, the family care plan. We will now present the Dimka family story. The Dimka family is a nuclear-type family. Ao is a 45-year-old male while her wife, Deka, is 40 years of age. They were married for 12 years but were not able to conceive early on their married life due to some medical issues. Deka has polycystic ovaries, which made it harder to get pregnant. Besides, she was prone to miscarriage because of her antiphospholipid syndrome. They now have two daughters, namely, Mia, a 9-year-old, and Sophia, a 4-year-old. Both Ao and Deka were born and raised in Canada. They live in a 3-bedroom high-rise apartment located in Midtown Toronto, which is accessible to grocery stores, health clinics and pharmacies, buses and public schools. Both Ao and Deka have African descent. After finishing high school, Ao took a training program that helped him land his first job as a machine operator. He now acts as the head of their department and waiting to be promoted as the department supervisor. Deka works as a cash register in a grocery store. Deka is a college undergraduate. Their combined salary is enough to support their daily expenses and the needs of their children. Mia, a 4th grader, who really loves music, currently taking piano and voice lessons. She is also a member of the hockey team of her school. While Sophia, who is recently enrolled in kindergarten, is taking ballet lessons. Despite their busy lives, the couple can still manage to cook and prepare food for their household. But, often, they go on trying to cook fast. And they tend to eat outside, usually fast food, every time they pick up their children from their recreational activities. The Dimka family is a member of the Pentecostal. They go on worshiping every Sunday. The family has no restrictions on medical practices. However, the couple believes that incorporating their faith into modern medicine is essential. Ao had a stroke, CVD infarct. 2 months ago the night his co-workers had a party. He was then rushed and admitted to the hospital. The imaging had shown a minimal blockage in the cranial artery. He suffered left-side hemiplegia and had some difficulty swallowing. He was diagnosed as hypertensive 5 years ago. He was prescribed with medication to help control his blood pressure. His father, Samuel, died at 61 due to a stroke. Before Ao was diagnosed with hypertension, he used to smoke 5 to 10 sticks of cigarettes each day. He continued smoking despite his condition. He then managed to stop smoking 2 years ago as per the physician's advice and through the help of the smoking cessation program. He can't manage to incorporate exercise into his busy schedule. Ao's weight is above normal. He loves beer. He usually drinks 2 bottles of beer when he watches his favorite sports weekly and when there are family or friends gatherings. The course of Ao's treatment has never been easy. He finds it useless and challenging during the first few weeks of hospitalization. He was often seen aloof and quiet.
I feel sorry for myself. How misfortunate I am.
He always requests that Decca provide the care instead of the nurse, which made him dependent on his spouse.
Can my wife do the care? Let my wife do that, please.
It must be really hard to be in your situation. But, we want you to understand that there are some tasks that Decca cannot perform.
But the health team did their best to understand Ao, and help him cope with his condition.
The whole team is here to help you, Ao. Let us help you.
Yes, that's right.
Ao developed a strong working relationship with the health team, especially to the nurses who cared for him.
Thank you for helping me.
We are happy to help you, Ao.
Decca is healthy at her age. She walks to and from her work. When she drops and picks up her daughters from school, and when she brings Mia and Sophia to their scheduled activities. But recently, she is showing signs of fatigue and stress from taking care of their children, doing errands and household chores that previously shared with Ao.
I feel really tired. All of these things are overwhelming. For how long will I do this? I need some help. But I must understand that I also need to do all the stuff for my kids. I just really need some help.
She needed to enroll her daughter in an after-school daycare program since the time of Ao's hospitalization. To have time visiting and attending to Ao's need, doing her job, and in managing their household. Her parents live in a different city far from their house. Ao has been recently discharged home and will be on an outpatient rehabilitation program in a facility within their community. He is now showing improvements. He was prescribed new medications to prevent his illness from progressing and in treating the accompanying health issue, which is depression. However, Ao is very concerned about his condition. He's worried about his daily life, his current job, and his relationships with his wife and his children.
My condition is affecting my relationship with my wife, my kids, and our usual routines. It is also affecting my kids' social activities.
I can't miss my practice game.
When can I go back to the ballet lesson?
Based on our family story, we have identified the following problems that need to be addressed and properly managed. Physical and emotional distress for Decca. Ao's depression. Care dependency and self-care deficit for Ao. Unhealthy diet. Deprivation of social activities for both Mia and Sophia. So, in order to help the Dimka family, we will be utilizing these tools to assess and provide care to them. The tools are the family genogram and EcoMap. Asking questions, therapeutic questions that we believe encourages the family to actively participate in the care. We will also talk about essential manners while working with the family. What psychosocial considerations are important to examine for the family? Next, we will offer the family our commendations. And finally, show them our care plan. Here is the family genogram, which shows the 3-generation family diagram. The 3-generation includes the grandparents, parents and their siblings, and then the grandchildren. We have also indicated in the genogram the medical conditions and health behaviors of the family member. We want to emphasize the health problems and risk factors that lead to Ao's hospitalization. Now here is the family EcoMap. The diagram shows different factors that directly and indirectly affect each member of the family. The arrow indicates which are the most affected of Ayo's condition. We want now to point out which among these factors can help the family. The family genogram and eco-map are useful in identifying the strengths and weaknesses of the family, which eventually helps the family. While working with the family, our group believed that the following manners should and must be observed to promote therapeutic relationships. In times of contacting the family and scheduling appointments, introduce the nurse's name and designation. State the purpose of the requested meeting, including who made the referral. Be factual about the need for the meeting but do not provide details. Offer possible several times for the meeting, and let the family select the most convenient time. Provide an interpreter if required, and confirm the date, time and place of the meeting. On the actual day of the meeting, be on time, or at least inform the family if being late. Dress up neatly and appropriately. Make sure to have your identification card or nameplate. Don't forget to introduce yourself. Wait until someone offers you to sit or politely ask if you can sit. Consider and acknowledge cultural customs regarding conversations. Smile during appropriate times and give the family time to talk. Do not interrupt. Respect their ideas and goals about the health issues while guiding them accordingly. Promote shared decision-making. And get the family's consent about the needed interventions such as healthcare referrals.
Hello?
Yes, hello.
Good morning. My name is Lucy. I'm a public health nurse. Is this Mrs. Dimka?
Yes.
I am calling to confirm my meeting with your family this coming Saturday.
Yes. It will be in the morning, right?
Perfect. I'm looking forward to meeting your family. I'll see you then. Bye.
Thank you. Bye.
Hi. Good morning. My name is Lucy. I will be your family nurse. How are you doing?
Please come in and take a seat.
Thank you.
The questions that we will ask the family are:
What might have been the most salient impact of Ayo's illness and rehabilitation on each member of your family? Who do you think is suffering the most in your family now? What kind of help does your family needs regarding your present situation? Also, who among your extended family and friends do you think can provide assistance or social support? And lastly, what are your expectations for our meetings? Are you satisfied, or if not, how do you think we can improve?
We will present to the family the psychosocial factors that influence them in their current situation. We will also show them the identified difficulties and challenges for them to know what are their health issues.
We have identified the following as important psychosocial factors that together, we need to examine. These are the couple's emotional status, your relationships as a couple, both your job, the kids' social activities, your extended family and friends, and also your religion. Now, based on our conversations, would you agree that your difficulties and challenges at the moment are Ayo's adjustments post-stroke, including his physical and emotional status, the role and function changes on each member, work overload, especially on your part, Decca, financial resources, lack or inconsistent source of nutritional food, and sustaining the kids' recreational activities?
Yes, you were right.
We will now tell the Dimka family our commendations.
I would like to tell you about my commendations. First, it is so nice to know that despite your family's challenges, you address these problems positively as you take them as trials or tests. Decca, I commend you for fulfilling your roles amidst the significant changes in your responsibilities. Ayo, you have improved a lot. I see that you have learned new skills that help you in your daily activities. I can say, that's an achievement. I acknowledge how you two keep on fulfilling your role as parents. I can see the love and your support for Mia and Sophia. And finally, I acknowledge how connected you are with the people around you, knowing that this is one of the strengths your family has.
The last part of our presentation is to present to you the family care plan. The nurse will then again discuss to the family the created care plan.
So, here are our priorities. Assess Decca and provide her interventions. Help Ayo deal with his feeling of hopelessness and sadness. Help Ayo learn skills to become independent. Educate your family about a healthy and balanced diet. And identify ways on how the kids can continue their social activities.
Yes, we agree.
Our interventions then will be based on the identified goals and priorities.
Provide emotional and physical support to Decca by including the help of Ayo's sister and mother in the hands of taking care of the kids. And sending respite care to Ayo so Decca can have some free time to take care of herself physically and mentally. Encourage social interaction to Ayo. Or, take him to attend social group activities so that Ayo will not feel alone and depressed. Refer Ayo to an occupational therapist to develop his activities of daily living so he would not have to depend on others for everything. Help the family to develop a meal plan to facilitate proper nutrition in their diet with the help of the nutritionist. And lastly, refer the family to a child welfare support to get financial support for the kids' recreational activities.
Thank you so much for helping our family.
Yes, we really appreciate your help.
You are all welcome. I am very much happy to help and support your family.
That's the end of our group presentation. We thank you for watching and listening.